welcome back to another Sit Down with Sam. I'm so excited for you all to get to know Dr. Liza. She is a chief resident at a New York hospital. She has a great story. She's very inspirational, and I'm so excited for you guys to get a little bit of insight of what it's like to be a doctor during the pandemic and just some other basic facts and information. So today I'm so honored to have a special guest, Dr. Liza from a New York hospital. She's a chief resident, and I'm so happy that you're here today. So before we begin, do you want to kind of introduce yourself? I heard that you know one of our board members, Teresa Sherry, so do you just want to share a little bit about how you guys met and just kind of that stuff?
Sure. So, hi, everyone. I'm thrilled to be here, and thank you so much for having me. I'm Liza Hartopoulos. I'm currently one of the chief emergency medicine resident physicians at a large New York City academic center. I kind of came to medicine in a really roundabout way. I always thought I wanted to be a doctor. But in my 20s, I worked in investment banking for about almost 8 years, during which time I also then moved to South Africa on a global health fellowship and lived there for just under a year, consulting the Department of Health of South Africa on their HIV program, which was incredible. And then I came back in 2008, which was a huge financial crisis. That's sort of when the housing market imploded. And I came back to help my former employer, JP Morgan, sort of weather that storm. So my sort of plan to become a doctor played out in a really long way. So at about 30 years old, I went back and did my post-bac, which is not the fun part of all of this. You have to do all your pre-med courses, like Physics 101, Chem 101, all that stuff. So I went back and did that while I was still working, and then went to downstate for medical school, and am currently now just starting my 4th year of a 4-year residency program. So I'm almost there. It's been a really long journey, but it's been an incredible one. And I have the pleasure of knowing one of your board members, Teresa Sherry. I got to play on the Princeton lacrosse team with her way back when, and she was and is one of the all-time stars of that program. And I'm just so thankful to have had that time with her and all of our teammates. It was an incredible journey, one during which we won national championships. We're really at the top of our game, and that is just a tribute to her, to all of our teammates, and the amazing bond that we had. So I'm so thankful for that friendship and connection.
Yeah, I know. I talked to her the other day. She had so many kind things to say about you. I was so excited to interview you.
Well, that is very nice of her, and the feelings are absolutely mutual. She's incredible, and she's gone on to do amazing things for the women's lacrosse community, and she's one of my dearest friends. So yeah, I'm just very thankful for her.
Yeah, that's nice. Prior to becoming a doctor, do you have a story that you can share about your own mental health and maybe ways that you used to cope with mental health and, kind of things just like that?
Yeah, so I think a really specific moment for me in terms of mental health struggles was after I had my first son in 2015. I really struggled with postpartum anxiety and depression. It sort of hit me like an absolute wave. And it was just something I never saw coming. And that was a really hard moment for me. And I eventually ended up taking an SSRI, an antidepressant, anti-anxiety medication for roughly 6 months after that. And I'm so glad I did. And I'm so glad I sought out the help that I eventually really needed. And it was an incredible recovery. And I again, was just so thankful I came to the position in myself and found the strength in myself to ask for that kind of help. And I didn't get to enjoy my first child the way any mom or parent should be able to. So um, I, I took the lessons I learned and that experience into my second pregnancy, and actually, without even any symptoms, started that SSRI again, just because I was very worried about that sort of coming back, and got to enjoy that newborn phase with my second son, I think the way everybody should. And was great. I think there's still, unfortunately, so much stigma and around talking openly about mental health issues, and that's why I'm so appreciative of platforms like this. And it's why I want to be overly transparent about my journey and my struggles, because the last thing there should be is shame and asking for help. If you have the cold, if you have pneumonia, if you have anything else, like medically speaking, you go to the doctor and you get treatment for that. And that's the same for mental health issues. And any role I can play in advocating for people to do that and get more resources for it, I'm thrilled to be a part of.
No, yeah, that's exactly what we say in our foundation. Like, why should you like kind of be shamed to go get like help if you're like anxious or depressed? But like, if I'm sick or like anything like that, the first thing anyone says is, "Oh, go see a doctor." It's just almost like, I don't know, why is there a difference? You know?
Exactly.
Yeah, I think that's so important. Based on your perception, what have you been seeing in the atmosphere in your hospital regarding the mental health during the past few years versus now that COVID has started?
So mental health plays a huge role in emergency medicine in New York City. Very unfortunately, over the last 20 years, federal funding, state funding for mental health services has been slashed. So a real blessing about what I do is that emergency medicine captures all people, all comers for any kind of need. So and I'm so thankful to play that role as sort of a gatekeeper to the larger health system. But it breaks my heart because we get a ton of people with mental health crises. And the emergency department is not the place where I'd ultimately want to help care for these people. It's just not an environment very conducive to managing acute psychoses, panic disorders, things like that. But that's often where we have to do it, in a loud, crowded, bright, sort of open emergency department. So we certainly have a lot of mental health patients who come through our door. And my job when they come through the door is to basically do a medical workup to make sure that there's not some metabolic or toxic reason, or God forbid, some kind of brain mass, something that's medically causing people to feel that the way that they're feeling. And once I'm able to safely determine that it's not because of some kind of toxic substance they have on board or anything else going on with them, like a bad infection, I then call my psychiatry colleagues who are in the psychiatric emergency department, and they come over and see the patient, and they'll do their full psychiatric evaluation. Is this somebody who is in imminent danger to themselves or other people, such that we need to admit them to the hospital in a psychiatric department of our hospital? Or is this somebody that we can give them close outpatient follow-up, give them a list of resources, and sort of safely send them out, knowing that hopefully in the next week or two that they can get that outpatient care that they need? And I would say the majority of our patients, unfortunately, in an emergency department, often need that inpatient care. Um, and that is tough too, because again, like I said, the federal funding and state funding for mental health facilities have just been slashed over time. So those kind of patients end up sitting in our emergency department for up to a couple of days waiting for beds to open up in the appropriate facilities for them. And it's just not an environment conducive to feeling well from a mental health perspective. And then sort of transitioning into what it's been like in the pandemic, when the wave hit New York, in a really eerie way, all of our patients, all of our typical patients, mental health issues, heart attacks, strokes, all the sort of things I care for every day in the emergency department virtually disappeared. And I think that happened because people were scared to death to come to the emergency department, knowing that most patients coming through the door were coronavirus patients. And that's true. So for almost 2 months, our mental health patients disappeared. And that really worried us a lot, because we're just sitting there thinking, these are people having crises at home, heart attacks, strokes, everything at home, and they're going to have poor outcomes because of that. And now what we're seeing on the back end, as the numbers start to come down, is our patients are coming back. And I'm glad they're coming back, but they are coming back a lot sicker. And that's because they didn't have the resources they needed for 2 months. They didn't have access to their medications or their therapists or their physicians for that time. So seeing a lot of increased acuity when we're talking about mental health patients or just medical patients.
So if someone is admitted to the hospital for a mental health reason, what are the protocols that you guys go through to help them?
In terms of protocols, I think, I don't want to speak for the psychiatrists because they're the ones who ultimately manage the patients. But I think the protocol that I go through as an emergency doctor is, and the most important part I can do for them is to make sure that there's not some underlying organic cause to why they're feeling that way. And oftentimes, especially in older adults, patients can come in with what look to be mental health crises. They're very agitated, very anxious, or what have you. And that can be because of an underlying infection. We see that a lot with older people, and urinary tract infections is like a good example of that. So it's super important for me to do a thorough medical workup to make sure that there's not some underlying medical cause that I can treat. And oftentimes there is. And that makes me feel good because I know that maybe a 3 or 5 day course of antibiotics can really turn them around and get people feeling better. But oftentimes that's not the case. So once that workup is done, my protocol is if people are still not feeling at their sort of emotional baseline or cognitive baseline, I need to decide if I think there's some underlying neurologic issue at play, and I would talk to our neurologist, or if it's more of an emotional issue, I talk to our psychiatrist. And that's what I love about what I do in the emergency department is I spend so much of my time talking to other specialties in the hospital and getting them to really focus on the patients I'm treating to get their specialty care right in the emergency department. And then from there, I feel badly. I wish I had more sort of guidelines or rules I could reference, but I just don't want to misspeak on the behalf of the psychiatry teams.
For sure. Is there any resources available to people that may come in feeling really anxious or depressed? Or, I mean, again, like, totally understand that, like, it's not your department, but is there, like, any resources that they maybe can, like, turn to, or, like, anything, kind of like that?
Absolutely. So, the great part of coming to a large academic center like the ones I work in is there's a huge network of care. So if we rule out all sort of the dangerous, imminently dangerous things, and we can sort of say we do think that this is an acute anxiety disorder or a depression disorder, sometimes we can initiate some medications in the emergency department in conjunction with our psychiatry colleagues. And then we always talk to our psychiatry colleagues, and we'll send people out with, depending on their level of insurance and outpatient follow-up, we can give them a couple of pages of outpatient resources they can call and get linked into. That's a great part of being in a big city like New York, and similar to the Bay Area and, you know, a bunch of other hubs in the country, is once you're in a big city, usually there's a lot of resources out there. I do worry about rural environments where there just aren't those mental health facilities and resources at people's disposal. So my hope is that with the pandemic and the rise of telehealth, that some of that becomes a nationwide thing. So people, you know, wherever you're located, you can have access to care if you have an internet connection.
So, how are your staff and colleagues dealing with their own mental health through the pandemic and just all the craziness and overworkload?
So I would say a lot of us, most of us, nurses, clerks, techs, physicians in the emergency department, what we just witnessed in the last 2 months was catastrophic. I don't think there's a better word for it. And we saw a lot of death, a lot of isolation of people. We felt isolated ourselves from our family, friends, not being able to care for our patients with human touch the way we would want to. And that has definitely impacted everybody. I definitely displayed signs of PTSD, hypervigilance, sleep disturbances, things like that. And I would say that is more common, I think, amongst everybody in the emergency department. So things the department did to try to help us and focus on our wellness. We had weekly Zoom meetings with our colleagues, like as a safe place to just go and talk about the very unique experiences that we've been having and share them with other people who have gone through them. And I think that sense of community and that shared experience is so important and validating in the feelings that we were all having. And the entire hospital system made psychiatric and psychology resources available to us essentially 24/7. And we were even at a point, not mandated, but we were all assigned one psychiatry session each, and you had to opt out of it if you truly didn't feel like you wanted it. So I think it's safe to say most of my colleagues at least had a 1-hour session with psychiatry or psychology to determine ongoing therapy after everything that we've just been through. And my worry after a big traumatic event like this for anybody is that it doesn't necessarily, the mental health side effects don't manifest right then and there in the moment. These are things that could rear their ugly, scary heads 3, 6 months, 9 months, a year from now. So I think we all have a responsibility in the emergency department to be looking out for our colleagues always. And we're just going to do our best to keep doing that for each other, I think, as we go forward.
I couldn't even imagine what you guys are going through. I'm just so grateful that we have just such an amazing doctors and everything that could really just help us out through this really hard time. So, do you have any examples of ways that your colleagues cope through this time, or just any self-care things?
So I would say the wonderful part about emergency medicine is it attracts sort of a variety of personalities and lifestyles, family structures, what have you. It's a really diverse group of people, which is amazing. But similar to that, it's like a huge range of coping mechanisms and responses to what we've just been through. So, I mean, for somebody like me, I'm a mom, I have 2 small kids, I'm a little bit older. I think things that have worked for me, maybe successfully or not, is I've always been a runner. So I do a lot of running, or trying to, but interestingly enough, during the pandemic, it was a little counterproductive for me because I would go outside and I would see a lot of people behaving like nothing was going on and not practicing social distancing, not wearing a mask. And that actually added to my stress and was pretty counterproductive for a period of time. Other things I do and did are I love yoga and find the meditative part of yoga to be really helpful. So that's something I do a lot of. And then I think the two most important parts were relying on my family. I have two little boys, and they sort of, knock me into a state of normal real quick with their craziness. And then just, again, that shared experience with my colleagues. Those are the only people at the end of the day who really know what we've all just been through, and being able to talk that out with them, even relive certain moments with them, has probably been the biggest saving grace that I've had. And I know a lot of my colleagues sort of feel similarly about that.
That's great that you all can be there together for each other. So, how do you handle anxiety in the moment?
So I am your classic type A. I I run a little anxious all the time, and I think that's part of my personality. And I think, for the most part, I have been able to channel that anxiety successfully and into productive work. But there are absolutely many moments in my life where that anxiety tips over and becomes more pathologic and really is dysfunctional and creates a lot of emotional burden for me. And that absolutely has been the case during the pandemic. That's absolutely been the case at certain moments throughout my training, throughout my life. Um, and all I try to the best extent that I can, be kind to myself and be self-aware of when that's happening to me, so that I can try to step back and reflect on it and figure out why it is that I'm tipping over, and to address the things that I need to address to bring that balance back to my life. And sometimes that's just been a night off with my family. Sometimes that has been seeking out therapy. Sometimes that has been relying on medication like the SSRIs I referenced before. And I think the most important thing anybody can do for themselves is to just not be scared of finding the help they need in those moments of crisis. And just know that there's a community of people out there, who all they want to do is support you through it, and take solace in that.
Yeah, exactly. So in the long term, how do you take care of yourself?
It's a great question. um, I've been thinking about this a lot, this concept of sort of self-preservation in a disaster. Um, and I think for me, it's just remembering what my values are and remembering why I went into medicine. Um, and why I went into medicine is because I wanted to serve other people. I wanted to help other people on the worst days of their lives. And that's emergency medicine at its core. And that's been this disaster at its core. Um, and that still brings me a lot of joy and a lot of satisfaction and fulfillment. But sometimes it can come at the cost of utter fatigue, exhaustion, emotional distress. So always trying to rebalance myself is something I just try to be very self-aware of. And right now, I will be totally honest, the balance is off. I'm, overworked, very tired. The anxiety has been tipping over a little bit here and there. And all I'm doing is just trying to be kind to myself and be aware of what I'm going through in the moment when I'm going through it. And right now, that's kind of all I can manage to do for myself right now. And it's a moving target every day.
I understand that your friend and mentor just died by suicide. Can you share a little bit about your friend?
So Dr. Lorna Breen, she was the medical director at one of our smaller sites and worked with me at our large academic center very closely. She was my attending for 3 years, and she had very nicely, in a way, sort of taken me under her wing because I have similar interests as she did, in administration and sort of running emergency departments and what have you. And so, I mean, you're talking about a woman who was what every physician should aspire to be. She was an incredible clinician. She cared immensely about her patients and would go that extra mile for her patients every day. She cared incredibly about every person in the emergency department. Um, she was a great leader and administrator. And she was always somebody who was trying to push herself to the next level to be better for her community, for her patients, for her colleagues. And, it breaks my heart that she's gone. It breaks my heart that, maybe felt like she couldn't fight the fight anymore. And medicine, the community, her family, we are now missing a real bright light in our world with her gone.
She sounds amazing. Yeah. How did this tragedy impact you?
It's broken my heart. um, and it's made me do my best to reflect on what has just happened to us as a community, as a country, as an emergency department. And it has made me be really vigilant with myself about being on top of how I'm feeling and processing everything, to the point that, I'm thankful, I want to make good out of the tragedy that's happened. And so, right after that happened, I sought out psychiatry, and I speak to somebody now once a week about everything that we've been through. And I'm so thankful for that. It's like been an incredible resource to me and a safe space for me to process what has been just utterly heartbreaking. And I just hope to carry on the amazing things that she taught me and did for our department and our community. And I hope to play a small role in carrying all of that forward for her.
So, my final question, and this is just something that I like to ask at the end of all of my interviews, is just is there anything that you would like to share to anyone that's watching that may be struggling with their own mental health issues? Any message of hope or anything like that?
Yeah, I think we all have our struggles, and some people will wear them on their sleeves and some people will bury them deep down. But I hope anybody out there listening knows that we all have our battles to fight with ourselves every day. And there is a community, a world of people and resources out there who just want to help and support every person become and be the best person they can be, and to find happiness in their lives. And the help is out there. And I just encourage anybody who feels like they need any help to find the strength in themselves to seek it out, because there are better times ahead. Things do get better. Every day there's a tough moment. But we can all get through it, but nobody can get through life totally on their own. Everybody needs help. Everybody needs support. And I actually think that true courage and strength of character is demonstrated in those who find it in themselves to ask for help, while understanding, almost brutally understanding, how hard it is to do so. So please just know, even doctors like me, have these daily struggles with ourselves. So there's absolutely no shame or weakness in feeling the way you're feeling. And all we want to do is support you and get you through it. I would just hope that anybody who feels like they are in crisis knows that an emergency department is absolutely a safe place to go if they feel like they have, if they're really feeling alone. And I just want everyone to know that that's an open door policy across the country. And that's a big part of why I became an emergency doctor, is to help people in moments of crisis. So, um, the emergency department is by no means the ideal place. I want to help people in crisis, but we are open 24/7 and we are trained professionals in it. And it's not a place where we would want anybody to have to be for too long, but it will at least start the process of getting people the longer term help and resources they need. And there's nothing more I'd want to do for somebody than help them on this journey.
Thank you so much, Dr. Liza, for being here. I'm so honored to have interviewed you, and I feel like people can learn a lot from your perspective of what just everything that you've been going through since the pandemic, and really have a lot more respect and also learn a lot more about mental health and just really taking care of yourself. So, thank you.
No, well, and thank you. I couldn't think more highly of your mission, and I couldn't think more highly of what you're doing to help people. And it's a beautiful thing, and just keep doing what you're doing, and we'll all get through this this weird moment in history together. But yeah, I couldn't commend you guys more for what you're doing, and keep shedding that light.
Thank you.